I am an everyday athlete.
I am an everyday athlete.
I am an everyday athlete.
Good morning, everyone. This is Jared Bassey with Mark McCain, and you're listening to Everyday Athlete, a podcast devoted to bringing you the amazing stories behind the lives of day-to-day CrossFit athletes like yourself. I have a very special guest today, the one, the only, the infamous, the beautiful, Dr. Aaron.
Beautiful.
Dr. Aaron Auburn. Yeah, well, handsome. Handsome.
It's all coming out now.
Yeah. Welcome. This is Dr. Aaron's here quite a bit. Most of you guys, I guess, don't see him. He's here in between location number 1, location number 2, correct?
Yes.
Yeah.
Yeah.
So, for those, I guess, who don't know you, most of our people know you. For those who don't know who you are, if you want to go a little bit what you do, where you're from, and
Sure.
general stuff.
Originally from Alabama, born and raised. Roll Tide more.
Oh,
And
shots fired.
yeah. So just born and raised there. A little bit of background about myself. I started out just as a massage therapist. I was a massage therapist at a pretty young age, and moved to onto chiropractic school. Lived in outside of St. Louis for several years. Me and my wife Jamie lived in Southern Illinois for a couple years, and we moved to this area. And we've been here for 10 years now.
So I know there's not a lot of crazy attractions here, but is there anything to do in St. Louis?
Of course, there's lots to do in St. Louis.
You still have friends there? Is that why you're saying that?
No. My
I've only driven through there.
Driven through there, yeah.
I've driven through there. I've stopped at the Arch.
yeah, I've been on the Arch several times.
Yeah.
Well, my mom's originally she's born and raised right across the river from St. Louis, and my dad is originally from Missouri. So my family is in the Illinois, Missouri area. So I kind of grew up in the St. Louis area too, going there several times. And my brother also lives about an hour south of St. Louis. So it's I'm a Cardinals fan, and yes, and
Digging a
so
deep
it's
This might hurt your business.
right, yeah. So yeah, it's a great city. It's a great sports-based city. So it's
They do. The Cardinals fans travel very well.
They do, and it was a little bit of a change going from there to here, and the fan base for the Reds, and now that's really grown because they built up downtown, which
Yeah.
it's something that they needed, and it's we go to Reds games. I'm not a Reds fan, but we support baseball and support the city.
I'll go to any professional level sport. It's
Right.
just fun to watch.
It is.
It's pretty much like when concerts are probably another way. Like I don't necessarily have to like the music to go have a good time.
Right.
Have you ever met Nelly?
No, never met. No.
I had to ask.
They're just going on ass that one.
Right.
I didn't know this.
Is he really that short?
Yes. What is EI? But that's cool. So, what age did you start as a massage therapist, and then what age did you go into chiropractic?
Right. Let's see. I was a massage therapist at 20, and started my business then. My first business. I went to a massage school in Birmingham, Alabama, and I was asked to come back there to be a bodywork instructor, just kind of fill in some of the educational classes, and then I started a graduate clinic there for therapists who graduated, and we gave a discounted fee on the weekends for the community to come in and get a little bit cheaper rate from someone who just graduated, so it gives them an opportunity to make some income right out of school.
Very cool.
So did that for just a short term, a year or two. Then I just wanted to kind of pursue a bigger goal, which was either wanted to be an orthopedic surgeon or looked into being a chiropractor, and went more natural route in that, and moved to St. Louis and started school.
So you started at 20, and then you are now how old?
38.
38. So it's almost 20 years in the business of having physically hands-on experience. with
Right.
people.
Yes.
And that's something you can't just mimic.
No.
You could be unbelievably smart, but I think even if you say half of your career 9 years ago, you're probably the same person as far as professionally you were now.
Of course, you just continue to grow.
Was that more of a kind of what's the word I'm looking for? I guess my question is do you see yourself kind of as you progress, just obviously physically you're going to know different things, you're going to learn different things, just as we would in our like kind of CrossFit professional, like I'm going to learn a different way to teach the clean, I'm going to learn a different way to teach the pull up. That's one thing, but I think as we've owned the business, it's been much different. Do you see yourself growing in that aspect too, owning your own business?
Right. I mean, you learn every day. I'm sure you guys see that as well, and you learn things from your members, from your peers. Sorry, and so do I. I learn things from my patients on a daily basis, and also learn things from my peers and through continue education. And as you always want to educate yourself more. I mean, knowledge is power. And so the more you know, the better you're going to help the community, the better you're going to educate the community, and they're gonna have the tools now that you guys and myself provide to them. So yes, it's a
constant evolution, right?
It is. Yeah. You just can't stay stagnant.
You're always a student. I think that's any good coach. I feel like describes business owner, whatever profession you're in. You're always a student, because I mean, again, especially now more than ever with obviously the internet. I mean, there's unlimited resources to anything you want to do, and I'm sure just like we pick up on certain things whenever people are doing these basic kind of movements. I'm sure you pick up on things with the chiropractic, like, oh, okay, this is what's going on again. I've seen this before, but there's still those unique cases that come in, and you're like, oh, okay, I might have to do a little more research than normal on this one. So I think that's what's really cool about working just with general people and movement, and obviously in your case a little more anatomy and stuff like that. So
how did you get into the world of CrossFit? I know you treat a lot of people from here, from other gyms. How did you kind of find your way into a CrossFit world?
Well, it's actually a patient of mine I remember here is that I can think back was Joy Collins.
Mm-hmm.
She just kind of brought it up to me. Just say, hey, have you considered checking out a CrossFit gym? And we were just talking, communicating, and I said, no, where'd you go to? And so she introduced me to where you guys were located at before, and
the old car wash.
Yes, the old car wash. So it's I went there and did an introductory class before you guys were owners there, and found out that there was going to be a transition going on, that you guys were taking over. Of course, I didn't know you guys personally at the time, so I just kind of backed off for a couple of months until you guys got in there, and I just kind of rejoined with you guys and been ever since, which is I'm glad I went back to the facility, because you guys are great with the community, great with your members, and been great to myself. And you guys really have a passion for what you do, and so do I. So that's why I stay committed to this gym and where I'm at. And it's.
Well, I think that just goes hand in hand. I mean, you talk kindred spirits, whatever you want to talk about. I mean, just having that passion, and you have to. Aaron, for those of you guys who don't know, has basically been a big mentor to both Mark and I, just being in the business or being in a small business for such a long time, and kind of the do this, don't do that. But what it really comes down to is you just have to be willing to endure the suck for long enough to really to see the other end. And Aaron, your business is picked up, but by no means are you any less busy.
Yeah,
right?
Yeah.
It's equally as busy, if not more.
Right. It's pretty constant.
Yeah. So every time I see Aaron, it's kind of like, I'm doing great, but it's tough.
But just go back to your point, saying it's you're not going to have those positive moments. You're not going to be happy all the time. Initially starting out in business, and we had those conversations a lot, and I wasn't either. I mean, there were definitely bad times at the beginning of my career where. Where am I going to get enough money to pay the power bill or the water bill, or where are patients coming from? And
you let that light bill roll over for a couple months, and
yes,
put a little down on it.
Yeah. So but if your heart's in something and you have a passion for it, and and you're good people, and you put that hard work and dedication into it, you're going to get that return from the community. And that's just pretty much for any business.
There's some intangibles, right, in business. I mean, obviously we can take this conversation, but just speaking to the small business owners, there's certain intangibles you just can't teach.
Right.
And that hustle and passion and so on and so forth. I think that's why a lot of people, you can throw out numbers on percentages of people that are unhappy with what they do. And I think the bottom line is, again, they're not passionate about it, or they don't feel included or they're making a difference, or whatever kind of label you want to put on it. But I feel like Aaron, we've obviously, I consider you a very good friend now, and you have an awesome family and business. And there's a couple times I'm sure where I've got on your nerves or whatever when we've talked or whatever you want to say, but just you talking me off the ledge sometimes with like, I don't know if this is going to work, or like, how's this going to happen? And you've helped us out so many different ways, and I'm just so happy that we didn't give up, and our relationship continues to grow. And
Exactly.
there's a lot of people behind the scenes, and you're one of them. That's kind of always, you almost, sometimes I feel like, man, does he like believe in this business more than I do? Whenever I talk to you, sometimes and you need those people in your corner, and they're definitely one of them. So I appreciate everything.
You're welcome.
I know you've mentioned the community here a couple times. How do you build a community when it's really, you're the go-to. Yes, you have employees there, but you're not in a group setting. You're basically one person in a room at a time. So how do you foster a quote community when it's really a one-on-one practice?
Right. Yeah. And it all goes back to in every patient that comes into our practice, we run a teaching practice. We have built that was kind of from day one, that we invest back into our patients and into our community, and we really want to educate our patients to give them the tools to better themselves outside of our office. I'm there. I'm going to do my job and my part in their healthcare and hopefully be part of their healthcare team. But I also want to teach them to do the things what they maybe were doing negatively outside the office. So now they can have a more a positive approach to, okay, I see what he's saying now. I was doing this wrong or doing that wrong, and now I can sustain the health of whatever the reason that they came into the office for. So I really try to just give the tools as much as I know, my knowledge, my education to them, so they can educate themselves and their family and the community. I always preach that in the practice, like, go home and teach your family what you're learning. It's not just for you. I'm not just giving this information to benefit yourself. It's to benefit your family, your loved ones, and whatever community that you're in. Because we all hear of people, I've got this injury, I've got this shoulder problem, I've got this knee problem, my rib, whatever it may be. And now you have an outlet of, hey, I trust this individual, or this individual told me to do this at home and see if this helps. And so that's kind of our philosophy and approach to practice is, yes, we're on a one-on-one basis, but I'm trying to reach more than that, with each person that comes in.
Yeah, that's huge, because I think the question might arise is, well, how do I have a quote community when it's just a small business, or maybe you're an online store, or maybe you're on this one-on-one basis, or you own a small store where you're only talking to one person at a time. Well, that's it. That's how you do it. Is you build into those individual people.
I think that's the trap that sometimes we fall into here, is we try to maybe hit it with broad strokes, so to say, and it should be a little more like a one-on-one, and individualized in the conversations. And again, because it's time, and we're a lot of times when we're here, we're kind of outnumbered, so to say, with more people than trainers, to have those like real individual, deep kind of educational type of conversations. And
it's a give and take for sure.
Yeah, and that's where a relationship with you comes in, to where obviously we're not doctors. We haven't gone through the schooling and stuff like that. Like you said, I like how you put it. Like, we want to be a part of their healthcare community, so to say. We want to put you through. We are a strength and conditioning specialist, and what we do, and our version of that is CrossFit. And we know how movement should look, and we know how the body should be loaded. But ultimately, if you have a structural problem, that's where obviously Dr. Aaron comes into play, or a physician or whoever you need to see. And I feel like so many times the education piece is what's lacking. It's like, I got a sore shoulder. Well, have you seen anyone about it? Well, no. I figured I'd just ice it once a month and it would be fine.
Yeah.
And it's it could be a lot deeper than that. I started seeing you about a shoulder. I saw like 4 different people about it, and whenever you basically fixed me up, I was like, okay. And not only did he fix me, he put me on like a long-term, like, where you're doing these movements, you need to be careful, and if this happens, then do this, so on and so forth. And you got to take that as law, not just like a recommendation. Like, I know he said not to do this, but I'm going to still put my finger in the light socket.
I mean, that happens a lot, and it's I'm their treating physician, and I come in and do CrossFit, but I'm also there to help them, and and they're there for a reason. So a lot of that mental approach that they come in with, as far as, okay, well, I know he told me this, but I'm still going to come in here and perform this movement. What can I still do this? And no, you can't. If you want to get fixed, and maybe a couple days off, it may be restrictions for 2 weeks, whatever it entails, what their injury is. But you kind of have to lay down the law, because I always tell them, hey, you're here for a reason. You're here for help. Listen, whether it's y'all two, whether it's Derek or Chris, and
that's even funnier when we get those moments when they're like, someone come in and be like, I'm ready to go, and they're like, are you? Because I talked to Dr. Aaron. You're not supposed to be
right. Yes.
But it rings so true. This is more is better concept. I think that it's so hard to get, especially with the mentality of CrossFit. Taking a step back is really tough to do, physically, mentally, emotionally. When it is from something you love doing, and everyone, it's like it's a really easy trap to fall into. Like, well, if I don't work out this week, I'm gonna lose everything.
It is, and everybody's here for their own reasoning, and those are things I have to consider with patient care too, is, outside of the room one-on-one, what is going on in their life. I talk to patients as I have an open door policy. It's just not just me providing the treatment to them. We talk about life and family and whatever football and whatever else may come up. But some people have to have that 5 to 6 day a week exercise for them mentally to stay stable. Their environment may not be that healthy at home or whatever it is, or they may be going through something in their life, and for you or myself to restrict them, they have that gear going, I have to be there 5 days a week, and it's okay if you step back some. But as far as we were talking earlier about the tools, it's our job to provide them the tools of why it's okay that they don't come in, if they have to take a break, if they're injured or whatever that is. And we learn over time with individuals, just as far as you guys go in your gym, and a little bit more personal things with them of, okay, why are you so frustrated? Why you don't want to heal, or why can't you take a couple of days off? So everybody has a different angle with that, And
that's the tough line we all toe, as far as you don't want to invade in someone's personal life, but there's sometimes you can tell, like, there's something else going on. Like, there's a reason you're here 7 hours a week. What are you hiding from?
Right. Yes.
Yes. And that's tough. And I don't know if you've had those instances where it's like there's no clear cut answer. Say, this is when I should stop bugging you about this, or when you get into their life a little bit deeper, because we talk about that from time to time. Because we want to be there for people. We talk about this little room as a sanctuary for people, but at the same time, I don't want to be invasive. I don't want you to talk about stuff you don't want to talk about. But at the same time, if I see something, I might try and bring it up. I don't know if you see that often with your probably.
Yeah, it's with my patients, we talk about a lot. Some patients just come in just for a quick treatment, and some actually sit down and dump things on you, which is fine. If they need to get rid of it, I'm fine with it. I have thick skin, I can handle it. It's okay. And I like to communicate with people. I don't know everything, and neither do you guys, but maybe maybe something that we say to them, may a light bulb may go off. Okay, I should just take this and go with it. But yeah, I like more personal approach to care with people in the community, and like I said before, somebody needs to get something off their mind. I'd rather do it inside my room rather than going out and doing something negative. Like stopping by McDonald's and eating or whatever it may be, and that way you kind of save them from that moment.
Sure.
Yeah, you definitely enter into that kind of life coach realm, where you're, you don't have to put that label on it, but where you're
part-time psychologist.
That's probably the better way to put it. And I think more than anything, whenever you are with one-on-one, I know definitely in the personal training realm, whenever I'm one-on-one with people, they're obviously a little more open, to the conversation. It's a little harder to pry whenever you're in a group setting, which is typically where we're at in the CrossFit class. But I think it's just that heightened awareness, you can kind of sense if someone's a little bit off, everyone doesn't, wear their emotions on a sleeve. It's like you said, sometimes, borderline can be invasive sometimes, but at the same time, everyone's dealing with their own kind of, baggage or whatever you want to call it. And like you said, hopefully that doesn't lead to them like, you know what, I can't do this anymore, or and again, it's one thing to follow through with fitness or care or whatever it may be, but a lot of times it just goes back to sedentary lifestyle or bad eating, or so that's definitely what we are trying to fight against every day, is people kind of leaving to do nothing, or if they're not feeling a part of this community that is Triumph. Ultimately we're a life raft in basically a sea of disease, because there's a lot of negative influence out there. Right?
That was the deepest thing you've ever said. Right?
Yeah, it's regurgitated, I'm sure, because I listen to everything.
Yeah, no, it is true. Like I'm not just saying to give you crap, but that is very true. I mean, unfortunately, there's a world out there that just seems like it wants you to be pretty unhappy for whatever reason. And the bare bones of it, what we're trying to do is just like bring a little happiness into people's lives,
Right.
At whatever level that is. Whether it's just having some friends to talk to, whether it's getting your sweat on, whether it's changing your life for the good.
Right. It's a battle sometimes. It's hard, especially if you're speaking. If I'm talking to a patient about nutrition, someone who may be overweight and they're struggling and are just getting started. Well, they step out the office and they go up to the red light and there's 4 fast food restaurants right there.
Right.
Yeah.
It's hard. It's hard for us, but they need us. We got to keep pushing that to them and push the envelope a little bit. Maybe get a little invasive with them because they need that. Because obviously nothing else is working for them, and it's too easy to be unhealthy out there. It's way too easy. So they need us in their life to give them that push.
Right.
Absolutely.
Yeah.
Absolutely. I want to save some of the more interesting stuff. We'll take a quick break here, but when we come back, I want to go through the probably what's on most people's minds, whether you're a lover or hater of CrossFit, which is am I going to get hurt doing CrossFit, and what you see in the medical field.
Right.
So we'll be right back.
Ooh.
CrossFit is demanding both physically and mentally. Setting goals are the foundation to push your athletic ability, and the hour we have together a day may not always be in line with those personal milestones you've set for yourself. Triumph Performance is based around just that, your goals. Together, in a one-on-one setting with your coach, we will set manageable and timely goals. Your program, unique to your needs, will accelerate the path to your target. Most have an idea of where they may want to go, but together with your Triumph Performance coach, we will assess your fitness level, develop a custom fitness plan, and keep you on track to successfully complete your goal. For more information, please contact a coach or email info@triumphstrength.net. And we are back. We're here, Everyday Athlete Podcast. We're here with Dr. Aaron. We left talking a little bit about the community and differences and similarities between us and kind of what he does, basically from a big group atmosphere, where I think that community kind of handles itself in some aspects versus where you're kind of the sole proprietor of said community. You're the one kind of driving it, right? But I think one of the questions that's on a lot of people's minds, are definitely on mine, that I'm curious about is, there's this huge scarlet letter, I think, against CrossFit that we've been trying to get off of us forever. It's like this bad name of you're just gonna get hurt. You're just gonna get hurt. And it's like, I've been injured more and worse on recreational soccer games than I have been in the CrossFit gym. So I guess just speak a little bit on what you see, whether it's pre-existing conditions, whether it's just lack of listening to your coaches or bad coaching. I mean,
right. Well, it's a lot of patients come in with injuries is just in general, just living daily life. But as far as getting questions, it comes up a lot, the topic of exercise and then CrossFit, because I talk about the patients, just for another option and outlet. It's not that I push it and force it on anybody, but there is kind of, CrossFit, I can't do that. I don't need to be in there. Gosh, I'd get hurt on day one with that.
Maybe that's the bigger question is what do you tell people that are maybe even interested in it?
Right. Well, I mean, just for example, our gym here, it's, hey, there's free classes to go in. You could go on a Saturday. I always offer, hey, I'll go on a Saturday with you. I'll take time away from my family. And if you really need to go to get in there, I want you to start exercising and better yourself, I'll go with you. Just call, we'll take you in and introduce you to everybody. Or there's, the kind of the on-ramp classes you can go in for free. and just see if you like it. Just go in and just move around a little bit, meet the owners, and see the community that's in here, and you'll be surprised of what it entails. But you're getting more of instead of you just going to a simple gym where you're going in by yourself. Nobody's really watching you or has a plan for you. In the CrossFit community, there's workouts every single day that are different. Of course, some days you're not going to like some of them, and some days are going to suit you better than others. But there's a schedule, there's a plan, there's a plan of action for each person that comes in here. So, but some small conversations in that aspect of it's not scary, you're just working out. And I always say this to patients, we're working out to exercise our heart. Our heart's just a muscle. Right. If you're in there to keep your heart healthy, everything else will just go along with it. So whatever approach you want to take to that is fine, but you need to know that things are safe out there to do. You get taught technique in a CrossFit gym rather than going somewhere by yourself and doing a class, not doing a class, but just walking in a gym and trying to squat. And
doing what we did which was just learn on your own. I mean, that's what I did.
Right,
and it was like, guess what? I got hurt.
Yeah.
Try and do it on my own.
Right.
And then having to pay someone to say like, hey, please teach me how to do this.
Right. And that's kind of where, you CrossFit gym and you guys fall into their exercise regime and their fitness is they're being taught correctly. How to move through a bar or how to do an air squat. I see that a lot. People don't even know how to squat, which is fine. If you've never been taught or instructed, or in my side of it, they could have a mechanical issue, but they're not getting any of that instruction in a gym, at all. So it's do you want to do things safely, or do you want to do things not safely and start developing injuries and bad mechanics, and with you guys that's not going to happen. I could step out of here and sprain my ankle stepping over the curtain. Right. You're going to get hurt different aspects. Yeah. So it's not that, yes, people throw the red flag up like, oh, I'm going to get injured if I do CrossFit, but they don't even know what it is. So the education about it, it's just like, somebody telling you false information about whatever it is, and you haven't experienced yourself, but you're still taking that, oh, they said this is going to happen. And
the great American one being like Chevy versus Ford.
Right, yes.
My family,
Yes.
we're a Chevy family.
Yes.
It's like, have you ever owned one?
Right.
Both are really nice.
So you don't know, right? So you don't know until you step foot and experience it yourself. Right. So so that's just more of talking to just a patient in general about their fears or whatever the questions they may have about CrossFit. But injuries, you're going to injure yourself no matter what you do, even if you have the proper technique and the mechanics in here. I mean, I've worked on both of you guys. You guys have done. I do stuff to myself too. I'm not, I'm there helping patients, but I also injure myself too. I'm not saying that I can do everything just because I'm a chiropractor and never injure myself. We live life. We make movements. So it's more about educating them through the technique. That's where you guys more come into it. I just kind of sprinkle some things in there with them to talk to you guys about, hey, watch this movement, videotape yourself. This is what I see what's wrong with you. You need to go back to them and go over that movement, a little bit more directly, whether it's just one-on-one or barbell club, whatever that may be. And that gives us a more visualization of, hey, your knee's going out, you're collapsing, your glute muscles are weak, whatever it is, you're in your front rack, your elbows way here, hand placements overhead, your hands way over here, whatever it is, you're getting that in the CrossFit community, no matter what gym you're at. Each coach that's their job, that's y'all's job to teach them that, but they need to become more aware of it, and that's where I come into, okay, this is how we need to fix this problem. Go back, get this corrected, which they'll review that, to make yourself less susceptible to injury. Because right now, if you continue this movement and the placement and everything, you will injure yourself. And it doesn't matter if you're in a CrossFit gym or a regular gym, or if you're doing something at home, working out, if you continue that pattern, you're going to hurt yourself every single time.
And again, you talk about recreational sports, you talk about even at higher level stuff. I mean, it's just the same thing. I did some damage and some stuff to my leg that it's like, that's because you just planted hard and we're kicking around forever. No one's watching you.
I think the thing, sorry to jump in.
No, please.
I think the thing with CrossFit, right, is we try to blur this line between form and intensity. I mean, that's kind of our MO, right? And I think ultimately, one of the things, I can speak to as a trainer, obviously been doing this for a while. I've seen, people do things horrendously and never get hurt. I've seen people do things perfectly and get hurt, so it's ultimately, I don't know if it's the best analogy, but it's like you got to cut the cord to a certain extent with people and kind of try to maximize their workout and educate them, but ultimately, like, they're gonna make a decision. I'm gonna be there to do everything I can within my capacity. If I see them rounding their back, I'm gonna tell them about it. Ultimately, everyone is not gonna listen,
Right.
and that's just in life. Hey, don't eat McDonald's. Well, it tastes good.
Right.
All right. Well, let's talk in 10 years, and see how that worked out for you.
I think you can narrow it down even more into, when you look at someone doing what they're supposed to or what they're not supposed to, and it comes down to self-awareness and ego.
Mm-hmm. Yeah, ego is a big one.
Like, do you have self-awareness? Well, and they're maybe even hand in hand. As far as, like, if you don't have self-awareness, you might have a big ego and not even know it. But if you're not coachable, or you're maybe you are coachable, but you just think you're, everything you do is going to be great. You might even listen to that coach, but you're like, well, it's correct now.
Well, I'm sure you brush up against it too,
Right, yeah.
Dr. Aaron, with people thinking, you're going to get hurt if you go to a chiropractor, or, this story, that story. And, it's one of the things whenever I recommend your care to someone and they're like, well, and they'll cite an example. And it's, it's one of those things where it's like, I'm sure you can find that in any profession ever,
Right.
whether it's going to a dentist or hiring a contractor, like, there's good and there's bad. Eventually you have to take your risk or whatever, educated guess or risk,
Right,
or
but-
whatever and go and do
Well,
it.
we all need medical care in our life,
Right.
No matter
Sure.
who you're seeing or what you're doing. But I always tell patients, it's fine if you don't get along with me. You need this in your life. Go see someone else. And if you don't like them, see someone else again.
That's one of the things that we follow too.
You
Yeah.
need to be with someone you feel comfortable with, and you take pride in yourself of getting the health care needs that you want, but you need to be in a place where you feel comfortable at, and it's don't not go because I heard this or that, or I went in one time to see this person, and I came in the gym one time, I just didn't feel comfortable. Like, okay, that's fine, we'll go somewhere else then. Go where you feel comfortable.
We're one of the nice things about having a free market. There's quite a few of everything of us and you and, like,
Right.
every profession. There's not just one chiropractor.
That's right.
There's an insane statistic on the number of small businesses that open up every year in America. I mean, it's just like an insane number, and over 90, I think, % of them, like, go out of business within the first year.
Yeah.
And it's just they're opening up kind of every day, but
Point is, there's choices out there.
There's very much,
And
very
I will
much so.
say, and I'm not just saying this because you're sitting right next to me, but you were the first chiropractor I ever went to, and I really didn't know what to expect going in, and it was pretty interesting. It's like I went in, and unfortunately I went in with some pain, and it was just like I'm expecting, like, go in there like just. Oh, I'm better,
Right.
But he's like, Aaron sat me down and said, "You ever been to a chiropractor?" No. Well, let me explain to you exactly what we do, and I'm going to show you exactly what I'm going to do. It's like, oh, I had an understanding of
Right.
what is actually happening versus, again, to use the analogy for anything, you just go in and someone just kind of like, well, here you go. This is okay. See you later. No one wants that.
Transactional.
Yeah.
Right.
Exactly. No one wants that. And I think that's one of the things that we modeled, after your business, after a lot of those more what we consider successful businesses, and just really trying to dive a little bit deeper into why that person's there.
Right.
That's huge. So what are some of the maybe not just with CrossFit, maybe just in general, what are kind of the more common things you see as far as why people come to see you to be treated?
Typically, it's your low back pain. I mean,
Yep.
that's predominantly what most people deal with on a daily basis, whether they want to get it fixed or treated or just deal with it on themselves. That's predominantly what comes in. Next would be more neck pain and headaches. That's just on a general basis of patients coming in. In our practice, we treat a lot of different things. I'm a certified chiropractic sports physician, certified kinesiotaping practitioner, working on a diplomat in sports rehab currently. we treat a lot of pregnant women in practice, a lot of newborns. We do a lot of nutritional work with whole food supplementation with our patients. So we do a lot of different, approaches to care. But typically someone's coming in for back pain, unless they've been, referred for a specific injury, whatever that may be. As far as sports injury goes, it's any and everything really.
Yeah.
Clavicle issues, shoulder sprains.
I'm sure you see kind of a pattern with certain sport-specific things as well.
Right.
Like I know Mark played baseball. He's a pitcher, so he's not gonna have probably a knee injury,
right?
And more so than like something in the shoulder. Versus like I played soccer, I have a lot of ankle injuries.
Yeah,
so I'm sure you see the pattern a little bit there.
We do. It just depends on the movement that you're doing predominantly in your sport. Anything can go at any time, but yes, it's just for example, here in CrossFit, it's shoulder issues, but a lot of that's just with mechanics, or they just are going too much and created that injury themselves. They didn't slow down.
Would you say you find a lot of those types of injuries, whether it's come from CrossFit or just whatever, is almost like pre-existing, conditions?
Typically, yes. Yeah, typically, yes. It's for the shoulder, for example, most of us anymore are having that anterior head carriage because of cell phones, iPads. We're looking down, especially our kids. Teenagers right now are more exposed to that, so they're getting more of the rounded shoulders, head going forward, and they come in here and do a movement, and they're in this position here, so they're already impinging their shoulder. Their head's already going forward, which is gravity. The bowling ball is going down and compressing the spine, and then you're throwing weight on top of that. So all that has to be retracted and then make the movement, which is predominantly going to slow down or completely prevent the injury itself. But a lot of times, yes, they're coming in, they build that up, and then they hurt themselves. Well, why did I hurt myself? It's well you've been building it.
As trainers or people, people that watch people move all day, what can we do as far as anything that we can tell people and or prevent that in a day-to-day situation?
The one thing I tell patients all the time is there's really just that chin retraction. If you're making a movement, I know sometimes you're going through the barbell here, and if you're doing anything overhead, or it's just really just keeping that. It's just a slight chin retraction. That's going to keep the normal cervical curvature that we have instead of straightening the spine out. Because when you straighten the spine out, all the weight goes down. The shoulders will internally rotate. Then you're going to decrease the space of your AC joint, and then that repetitive movement is going to wear and tear. So really just one great exercise, that you guys use in warm-ups too, is just the therapy band pull-aparts. That's just a good burner, warm-up.
Yeah, it's amazing how
to get upright.
How about 30 of those in, and everyone goes,
it changes.
What happened?
Yeah, it changes your mechanics immediately. Yeah. And I have them at the office, and I'll do them as well in between patients sometimes, and I'll instruct them, hey, you can hang these anywhere at home or office, and just knock out 15 to 30 in a row, and you'll be amazed if all of a sudden you just start, your posture changes. Even if it's for that instant, it's better than not doing it for the whole day.
Right.
I remember when I was coming back from shoulder issues, just literally, I think what changed the game for me was just being intentional before I would go to bed each night, 10 minutes with the ThoroBand. And I would do the swords, pulling it up and turning the thumb up, and then the swords, and then the pull aparts, and I believe it was like behind the neck kind of presses, because I have a bad anterior kind of lean with my head sometimes. And anyway, so it's just, I know that I play baseball and all these other things, but it really does come back to posture, I think, for a lot of us. Just being aware of, man, you're in a really just bad position, you know, and that's what, Kelly Starrett obviously really changed the game with a lot of that stuff, as far as in our community with lacrosse balls and, making mobility sexy, or whatever you want to say. And, but you have to apply it. I mean, like, again, with what we're saying, what he's saying and you're saying and telling all these people, it's just literally, for me, it was literally just 10 minutes before I go to bed each night. I was like, all right, I'm going to, I need to get my shoulder fixed. Like I need this to happen.
Yeah.
And it's amazing whenever you set your mind to like healing things or preventing things, like it actually could work.
You have to do it, because if you tell someone to do this on a daily basis, they're going to go home, and I see this all the time. Well, yeah, I stretched once today. That's not going to get it done.
Yeah.
I'm always given a larger number.
You have 24 hours in a day, and the 3.5 seconds you held that stretch is not going to do a lot.
I always 10, 15, 20 times a day, which, blows their mind. What do you mean? That's all day long. It's really not. It's probably like 5 minutes total for the whole day.
Yeah.
But do you want to heal faster or not?
Comes down to a couple things, and we can go down the rabbit hole, so to speak. But you talk about again self-awareness and just habits. Those healthy habits. Like you talk about, like 10 minutes before I go to bed each night. Like, how could I ever possibly do that?
Right.
And you're like, meanwhile, you're like,
You got your show on.
every time, and I'm super. I'm not like saying like, oh, I do everything amazing, but like I'll sit on and roll out, and I'm rolling out, and I'm 25 minutes in, and just scrolling.
Yeah.
It's like, wow, imagine if I actually would have rolled out for 25 minutes. I could have got up and like, wow,
Yeah.
I feel amazing.
Oh,
And
yeah.
some days I'm there, other days I'm not. But you talk about like that 10 minutes right before bed. Like if you did that, like, man, you're going to feel great. But I think what happens, at least personally speaking, is like, well, I do that and I do a fantastic job until I feel better.
Yep.
And then it's like the maintenance period kind of will dwindle off. And then it's like, oh, something's going to flare up.
Yeah.
And then you go back.
You got to maintain the health
Yeah, you have
of
to.
yourself, because it's not, you can't base your life on sick care. You got to base it on well care.
Yep.
And most of the community is based on sick care. Oh, I'm hurt now. I'm feeling this symptom now. I'm going to get something done, rather than reversing that and trying to maintain the health as best you can. But yeah, unfortunately, that's just what's out there, and it's our jobs to try to
A big
change it.
big switch over for me too was like finally understanding that like we are organic beings. Like we're not as symmetrical as we think we are. Like just because I have two arms and they're roughly the same length, my hips, like you're not that symmetrical.
No.
And so like it's like things are going to move.
They are,
Your spine is not and your skeleton is not this like piece of rigid steel. Like there's parts that move in there, and it's gonna get out of line.
It is, yes.
And that's something you have to maintain. You talked a little bit about the shoulder. So the other big one I think is hips and lower back. You say that predominantly it's lower back issues. So what's the main cause you think of?
Glute weakness is predominantly what I see all the time, and it's in your pelvic rotation. And I go over with patients all the time. Your pelvis is rotated. What does that mean? What did I do to it? Well, it's just your SI joint. Your pelvis comes around and attaches in the back to your sacrum, which is a diamond-shaped bone. It's a very long joint on both sides. So, we're predominantly sitting in hip flexion all day. Us three right now are in hip flexion. And unfortunately, that's what people do for their career. They're sitting in a computer all day, and they're in hip flexion all day. So when they finally get up, that joint has been locked in that position. And when you get up to move, that joint could just stay pretty consistent where it's at. So, as far as exercising goes, if you go into a movement, to say you're squatting, we reviewed this before, and you have that fixated joint here, and you have an imbalance of glute weakness, and you're squatting, and then somebody comes in, well, my back's hurting right here, I don't know what I did to it. You're not firing your glute muscles because they've been inactive all day. I mean, if you really think about it, you get up in the morning, you sit down, you eat breakfast, you're in hip flexion. You get in your car, you're driving to work, you're in hip flexion.
Right.
You sit all day, you're in hip flexion. You go to lunch, you're in hip flexion. You drive home, you cook dinner, sit, and then finally you sit at home to watch TV before you go to bed.
Yeah.
You're constantly in hip flexion. So if you're not activating or turning on those glute muscles, they're going to be inactive, and then if you start actually physically working them in the gym, they're not firing properly. So it
takes a while to and again, I'm 100% right there, where it's just like it took a long time to learn how to actually like when people say squeeze your butt, you're like, what? Like,
Yeah.
It's tough. It's a tough thing to do if you don't know what exactly we're talking about.
Right.
And I think there's something a little bit deeper there too. Like and again, understanding that, when we go through our fundamentals program, we are teaching you the basics so that when you get into class, you are not completely lost. And again, it's up to us, but it's also, again, that self-awareness that like you've sat for the last 30 years. You getting to the bottom of the squat and trying to go up as fast as you can may not be necessarily for you. That's why, we get boxes out. Like, I just want you to think about a kitchen chair, sit down,
Right.
stand up, and just trying to get that base of fitness down. But unfortunately, people, again, call it society's problem, call it whatever you want, but like we just need these immediate turnarounds. Like, well, I've been doing this for 6 months. Why am I not better? It's like, because you sat for 25 years.
Right.
How do you feel about standing desk?
Oh, great. It's always pushed that, especially when I have patients come in and they're HR directors and, hey, how about, they get excited that we discuss what they're doing during the day as far as, hey, incorporating a stand-up desk. Well, you need to have the other employees. They need to have that availability too. You don't have to stand all day, it's a good balance to go back and forth, but yeah,
Sure.
You can't stay in the seated position all day.
I've heard of kind of like the 20-minute rule. If you're sitting down, get up, move around.
Well, I always advise
truth?
everybody
Yeah.
to, when you are sitting all day, to get up and just before you make a movement, just stand there and tighten your glute muscles up for
Right.
15, 20, 25 seconds, and that gets them engaged, instead of them being turned off.
I know I have a kind of an anterior tilt, and that's one of the things, like my butt kind of sticks out, and I'll get that kind of arch in the low
He's
back.
got a nice butt. I mean, let's face it, Mark.
Well, if you're listening to the audio version. Anyway, but that's one of the things I immediately notice whenever I do squeeze my butt is like it aligns that pelvis. And I feel like a lot of people, and I've got a good squat or whatever, but I know whenever I'm lifting heavy, my right side's a little jacked up, and it's in particular my right glute doesn't always want to fire. So I personally have like a special warm up that I'll do with some back extensions, some good mornings, some different one-legged, type stuff to fire my glutes eventually if I'm going to go heavy that day. And personally, from working out over the years, I have a pretty good assessment of where I'm at with certain movements to where I'm just not feeling it today, or something's a little bit off. And that's definitely when people are, regardless of age, but if their training age isn't really that high, not, again, like, I mentioned earlier, it could look good, but if it's not feeling good to them, or like, hey, I've got this like really loud clicking or cracking sound in my knee or my hip, and maybe speak to that a little bit whenever people are there's several people here that when they squat every time, it's like my knee clicks.
Right.
And that's a popular, like, what should I do?
Well, let's kind of backtrack of why
Sure.
that's happening or what that actually is. We've all popped our knuckles before, or we've gotten out of bed and our knee or ankle has popped. That's just nitrogen gas releasing. That's all that consists of. So that could be an example of what's happening with them through the movement. But you can also get that audible noise when your ligaments, which are hold bone to bone together, become tight, or the tendon, which holds the muscle to bone, become really tight too. And it can roll over and snap. It just depends on the person's body, their makeup, their anatomy, how much weight bearing they have. If they're older, if they've decreased some space in their joint, that happens too, and that can create some audible noise through movements.
I feel like it's a different sound. Can you tell the difference between the sound? I feel like a joint popping or the knuckle popping sounds different than that ligament rolling over.
Now, they may not know that, though, going in, but yes, I mean, it can vary as far as the noises go, but as far as are they damaging, are they hurting themselves, well, they need to be evaluated to see what's going on. I mean, especially if you guys at the forefront see them incorrectly squatting and then they're making that audible noises on that one side, then they need to be assessed, because they have an imbalance going on somewhere, or structurally, their anatomy could be altered with their skeletal system. They could have osteoarthritis, unfortunately, in the joint. And you guys don't know that because you can't see in someone. They'd have to have an x-ray with that and evaluation, but unfortunately that can happen too. And if that's the case, they need to be aware of it, okay, well, you have loss of joint space. Here's what you need to do to be more proactive so you don't lose it at a faster pace than what you've been doing right now. So, yeah, I mean, it's better to know than not to know. You just can't guess all the time. My knees always popped when I did this or that.
I like what you said, too, there. It was like, you might have to get an x-ray because we can't see that. Like, people have come to us with medical questions, and I'm like, and the answer is, I'm not a doctor.
Right.
That's not my forte. I can tell you who to go see, but it's up to them to really go get that checked out. And it's like when we see someone with a membership hold request or a cancellation request, and it's like, well, have you went and got this checked out? I'm like, well, no. I'm like, well, regardless if you're with us or not, which is fine, because that just means this might not be for you right now, but like, go get whatever the issue is at least looked at, because
life's too
whatever
short to
whatever you
be
do,
hurt,
whatever you do after this,
all the time.
it's gonna hurt again.
Right.
Yeah.
You know, whether it's by yourself in the basement, a regular gym, go running on your own. If it's
Well, most want to, wait and see if it heals by itself or heals on its own, and actually you're causing more damage to yourself because your body. I mean, innately we're trying to fix ourselves all the time, but that's where compensation comes in. So your body may mask the symptoms that you're having because your body's always trying to fix itself, but you're creating issues in other areas, and they're unaware of that because I'm just letting my body heal itself. Then they start feeling better. Well, that problem never got fixed. The body's just masking the pain, and now you've developed issues somewhere else. So when you do start back, it's going to be more detrimental to you because you're going to blow. You could blow something out. Then when you don't have stability in a joint segment, that's when you get your tears. That's when you can blow a shoulder, tear a meniscus, whatever it is, and it's all because, unfortunately, it's your fault because you're unstable. Now, there's trauma out there, saying,
you get hit by a car and you're tearing meniscus.
Yeah. But a lot of times we set those problems up ourselves. Unfortunately, if you're not proactive with keeping it healthy.
How do we get people to understand this? Like, this is a loaded question, right? It's this paradigm shift to where they have to take an active role in their life, from the sense of I need to be conscious of how I'm sitting, how I'm standing, how I'm working out. We're all doing it right now, and that's why we need to get headsets so we can have a standing podcast.
There you go.
Anyway, but you know what I mean? Like you can kind of see where I'm going with this. Like it really is a paradigm shift to where I'm good, everything's fine. Oh crap! I just had a heart attack. You know what I mean? Or unfortunately, that these big things have to happen where it's like, oh, I just dropped my pencil on the ground and I pick it up and I felt a snap in my back.
Well, that goes back to what we were talking about earlier about educating. I mean, you gotta, and being invasive. You were saying earlier, you gotta kind of do that. I mean, it's a part of it. That's what we signed up for. If that's who you are individually, and I know you guys are, and I am too. You gotta kind of get in that, cross that boundary a little bit to teach them, like, here's what needs to happen, because yes, people will wait for a long, and for an example, for someone who has knee pain, they come in and they're 60 years old. Well, I've had knee pain for 3 weeks. It's not going away. What's wrong? We'll do some imaging. Hey, you're actually bone on bone. I'm going to refer you to an orthopedist. Well, there's nothing you can do for that. No, I'm sorry, you're bone on bone. Well, did this just happen 3 weeks ago? It's actually happened the past 40 years of your life. You haven't done anything, and you may not have been educated, but you are now from this day forward. We can't go back and change what has happened. That's irreversible, but you can educate yourself maybe to keep the other knee healthy from this day forward, or whatever joint space you have left. Sometimes it's just that fear will get them going of that something bad has happened, and what can I do to make these changes.
So sorry to jump in. So if I'm 25 to 45 right now, maybe I'm listening and I feel pretty healthy, but I know this knee or this, like, where do people start?
Right. Well, I mean, they're starting in here. They're getting fit and exercising, but really just starting to get. If you're 25 to 45, I mean, obviously getting a physical done, having a good group of staff and whatever that may be, a good support system from your family. But you need to go through some steps to get evaluation done of where you're at in your life as far as your health is concerned. And if they are stepping in the gym for the first time, or they're stepping into a chiropractic office or an orthopedist or a physical therapist or a massage therapist, it's our job to teach them that, hey, you need to get this evaluated. Have you looked into this? Have you had this done before? Maybe you need to start setting some goals as far as your nutrition is concerned. I see that you are 20 pounds overweight. Some of those can be sensitive subjects, to someone, but you got to get your foot in the door somewhere and build that foundation so you have a team that can help you. And it's not easy. I mean, it's kind of, we're saying to do this, but that person is sitting there and well, I'll maybe put that on my calendar to do later, or I'm okay. I'm just like the reason why you asked your question. I'm okay. I don't need to get this done. Well, things are building. Things are building, and it's go get blood work done too. I always tell patients, hey, have you had your blood?
That's a big one.
Yeah, have you had a
you
colonoscopy?
Might be eating things that aren't necessarily agreeing with you.
Right, and you need to be aware of that, because we only get one of these.
Right,
and
sure.
And whatever you do with it is what you do with it. But it's silly to throw things away or just think that you're okay, and then all of a sudden something happens to yourself.
Until it's too late. Yeah, absolutely.
Yeah, I think it's one of those, people almost scoff at it when people are like, my body's a temple, or if you go out and like you're the guy that's not drinking, or you're the oddball that got a salad at a pizza place, and it's taking a minority position sometimes, and being okay with that, especially like you said, hey, I've only got one body. And here's what's great about the internet. If you are like, well, I don't have a doctor, I'm new to the area, there's this little thing called Google.
Right. Yeah.
And guess what? There's a lot of reviews out there.
Yeah.
And 9 times out of 10, if there's only a couple reviews, or whatever, you should be able to pick up a vibe just from a website and reading on the, so do a little research. Ultimately, don't just take our word for it. Like, look online and take a proactive approach to health.
Right.
Yeah,
Yes.
100%. I got a few questions, and again, these are just kind of personal ones because we've both been under your care, and you just get a real good pop, and it's just, oh, that was a good one. What is your favorite thing to crack on somebody? What's your favorite thing to adjust, I should say?
I mean, the neck, for me, the cervical region, the neck, just because typically that's what someone is more afraid of coming in to see the chiropractor with. Like, oh gosh, what is he going to do with my neck? I've heard these stories, and they're a lot of times terrified. I was too. My older brother's a chiropractor, and he would practice on me, and I was scared to death. Like, what is he about to do to me? Yeah, right. And but getting through that, which is more my favorite one, because it makes the patient more at ease when they have received that, and now they feel comfortable about doing something about their health care, and they're no longer scared anymore. That's really cool. So that's more of an amazing experience to me. And then I would say, not just an area that's my favorite, but I really like working on children, especially newborns, because that means I've done my job of educating the parent where healthcare should start, and that should start immediately. And to take that step to have, because they never received it as a child typically, to them to take that step and expose their child to maintaining the health of the nervous system and a healthier body and a lifestyle, and they're starting that right away. It's pretty amazing, and I always, tell the parents that too. It's like, your child's going to thank you later in life, because they're going to be typically healthier than anybody, that they're with growing up, and they're going to have a healthier immune system, and so that's to me personally, I really.
It's very interesting, and to the point of educating, the parents through a newborn, getting that jump start,
right.
And generally speaking, if you have a newborn, you're probably not in your 50s or 60s. You're a little bit younger, so you can have that. Okay, well, I don't have to wait till I'm 50 to have this experience. It's huge.
Yeah, and it's would say I'm just in a newborn, and they come out in the hallway, and there's patients sitting there, and you just adjusted that child, because typically an adult's afraid to have anything done, and they think, oh my word, that's a 6-week-old. What in the world did you do to them? What's wrong with them? And it's pretty amazing.
Like nothing. This baby was in this tiny womb for 9 months.
Yes.
And
I mean, my children, we attempted a home birth with my son Jackson. He's 5 now, and then we did have our daughter at home with a home birth. And so an hour after both of them were born, I adjusted them, and treated them. And I had the fortunate experience to, my daughter just in our bedroom, in a nice, safe, comfortable environment. And they've started ever since then. So it's.
Do you think in the future there'll be standing wombs?
Right.
Yeah. So they can just come out perfect.
Perfect. Right.
Shoot
right
already
out.
Set.
Shoot them right out.
And then I forgot to ask this on our last podcast, but again, it's always one that is really interesting, especially this conversation we've had. Really interested to see what you have to say, and it's just the simple question of what is your definition of fitness?
Well, in my mind, fitness is pretty much just maintaining the health of your mind and body through physically exercising, mentally and physically, whatever aspect or avenue that is, if you're getting it here, if you're doing something else. But I feel keeping both of those healthy is really, capacitating your whatever your fitness goals are.
Fantastic.
That's good.
Well, thank you, Dr. Aaron. Thanks for
thank you.
Thanks for hanging out.
Thanks for having me, guys.
Yeah,
I appreciate it.
All right.
And thank you all for listening to Everyday Athlete. Join us next week as we dive deep into the lives of those who make us great. Thanks.